Hi, and welcome to the home-based exercise introduction video. My name is Amy Kazar, and I'm the Pulmonary Rehabilitation Supervisor at UC Davis Health System. I want to thank Boehringer Ingelheim for their generous support in this presentation and exercise video series. Also, Pulmonary Fibrosis Foundation and the American Association of Cardiovascular and Pulmonary Rehabilitation. Hello and welcome again. I am so excited to show you these three 30-minute pulmonary rehabilitation exercise videos in the comfort of your own home. You will not need any of the standardized exercise equipment like dumbbells and resistance bands. The equipment we're going to use are going to be items that you can find in your own home or at the grocery store. Water bottles double nicely as a set of dumbbells, and you get to choose the weight that is appropriate for you. The videos will demonstrate a certain number of sets and repetitions, and it could be 2 to 15 or 2 to 10 or 2 to 12. You should only do what you're able to do. This means stopping at 10 reps to rest and recover if that's what you feel is necessary or your shortness of breath is unmanageable. Now, some of the exercises will have you using your own body weight as an effective way to build strength and endurance. I'd like to point out that these workouts have been provided with your health and safety in mind. However, individuals have their own limitations. It's very crucial that you consult with your physician before beginning this or any other exercise program. These workouts are not a substitute for professional medical diagnosis, treatment, or advice. By participating in this exercise program, you do so at your own risk. Remember to stop if you experience pain, dizziness, or unmanageable shortness of breath. Now, pulmonary rehabilitation has shown to increase exercise capacity and decrease symptoms of fatigue and shortness of breath for patients with pulmonary fibrosis. While the exercise will not change your lung capacity, what it's doing is helping your body use oxygen more efficiently and contributes to an overall sense of well-being. Now, in spite of the value of pulmonary rehab for the pulmonary fibrosis patient, many don't have access to a pulmonary rehab program near them. Or the COVID-19 pandemic certainly has thrown everyone off their game, and many pulmonary rehab programs have had to close temporarily. Now, some pulmonary fibrosis patients or others might even be reluctant to go back to their programs when they do reopen because of that continuing risk of infection, and all very understandable. And so we hope that these three videos will help take the place of that. Now, where should I start is probably what you might be thinking. So the beginner video, this is a video that you will want to use if you are new to working out, do little or no activity, or have more of an advanced lung condition. The exercises are designed to prepare your muscles to move with proper form and breathing in order to build strength and muscle memory. The focus will be on posture, breathing, and we'll be starting with the upper body, then moving to the lower body for strengthening while incorporating flexibility and balance. The workouts are performed mostly seated, and the duration is 30 minutes, so remember to pace yourself. Building a solid foundation with the beginner routine will ensure you get the best results in the long run. The intermediate video, you may want to follow this video if you have progressed from the beginning level and you have been doing some physical activity 2 to 3 days a week. The intermediate level exerciser should have knowledge in proper form, breathing, and understand modifications and challenges to suit your level of fitness and degree of shortness of breath. The workouts in the video will be shown standing, but they can also be done seated, or you can do a mix depending upon your abilities. Balance will be challenged by changing your base of support in this workout. The workout is also performed for 30 minutes, so remember to pace yourself. The advanced video, you may want to follow this video if you've progressed from the intermediate level or you're a regular exerciser. Advanced exercises will be combining exercises for the upper and lower body that will challenge your body in a very safe format. So let's take a look at these 3 levels. I'm going to use bicep curls as an example. A beginner will be doing seated bicep curls with the focus on posture and breathing. That's our foundation. An intermediate will be standing bicep curls and will be challenging the balance by changing your base of support. So we're working on static balance. An advanced exerciser or exercise video will be standing bicep curls with an optional dynamic balance challenge, such as doing a bicep curl and then stepping out to the side in a lunge. Now review the checklist. Always make sure that you have checked with your physician to let them know that you want to start exercising. Before starting any program, you always want to make sure that the exercise routine is safe for you, and your physician will be able to give you some guidelines. Now, if you're using supplemental oxygen, ask your physician for specific instructions on the settings for exercise and rest. These could be different. Supplemental oxygen will significantly improve your exercise performance, reduce your sensation of breathlessness, and prevent exercise-induced hypoxemia. Check with your healthcare team to know what you need to look for with each of your vital signs. Let's start with your heart rate range. Where would your physician like you to be exercising with that heart rate? Also, your blood pressure range, your oxygen saturation range, and then also your perceived shortness of breath rating and your exertion rating. Usually what's recommended by the American College of Sports Medicine is that it is safe to exercise within that 4 to 10 or 4 to 6 on that scale of 10. But you need to make sure that it's always comfortable for you. Now, if you're a diabetic, make sure that you've checked your blood sugars before you start exercising and ask your physician what range you should be in. Now, before each exercise session, it's really important to check and log your vital signs, just as if you were in a pulmonary rehab program, that standard checking in. So routine monitoring of your vital signs is so important to evaluate your safety to exercise and also to track your improvements. Refer to the handout for this form. Now you want to check your heart rate, your blood pressure, your oxygen saturations, rate your shortness of breath at rest, and also rate your fatigue before starting the exercise. Make sure you've checked your blood sugar and you have appropriate nutrition nearby if needed. And then also pain is a big factor in our exercise tolerance. So monitor what your pain is on a scale of 0 to 10. Now, staying safe during exercise. It's really important that you have adequate space for movement with good lighting. There's a non-slip floor. There's nothing there that could be a potential tripping hazard. Make sure you're dressed for comfort. Wear shoes that fit well and support your feet. That means stepping out of those slippers and putting on your workout shoes. Now, it's always best to have a family or friend home while you're exercising, just in case something were to come up where you did not feel well. Have a sturdy chair, either with or without arms, and make sure that chair is stable enough to support you when you're seated and when holding on to during the exercise for a standing exercise. So please, no folding chairs. Use your monitoring equipment to assess your vital signs as well. So having that pulse oximeter nearby. Oxygen if needed. Now remember, many patients with pulmonary fibrosis will experience significant drops in oxygen saturations with activity. And you want to make sure you are counting for this before you start the program. That way you can increase that oxygen flow rate before you start the exercise. So have your physician give you some guidelines on increasing that flow rate to a certain saturation. Also, your weights. Remember, if you don't have any weights like dumbbells or resistance bands, I want you to go ahead and grab the soup cans that are of equal weight or water bottles that are equal weight to do these exercises. And the videos will be using only those types of props. Also have your own water bottle to hydrate, and then a towel. Now, what weight should you start at? It's always best to start with a light weight at the beginning of an exercise program. So a water bottle that weighs either 1, 2, or 3 pounds is usually a good starting point. And you want to begin with either 1 to 2 sets of 10 repetitions and gradually build up to 12 reps, then 15 to build on your endurance first. Once that becomes easy, then you can increase your weight and then begin again at 10 repetitions and gradually build up to 12 and 15 again. Now, you may experience some muscle soreness 24 to 48 hours after your workout, especially if you have not been doing any exercise or very little. So gentle stretching and staying hydrated is usually helpful to easing out this soreness. If you have muscle soreness over 3 days, please think about scaling back on the number of repetitions or the weight that you're using. And if that does not work, please reach out to your physician to let them know. Now, don't exercise if you have worsening shortness of breath or cough, worsening oxygen levels on your usual oxygen prescription, if you're having any kind of treatment complications, or complications from any other medical problems. Make sure you call your physician to report these symptoms promptly. It's always very important to listen to your body and to stop and rest when necessary. Now, the next 3 slides will be showing you some additional information that you can find on the resource page. So if you want to start out with an 8-week comprehensive fitness program, this is one that's designed for beginners. Notice that your resistance workout is 2 days a week, and on opposite days, your endurance workout is 2 days a week. And you'll see some guidelines there with that 1st to 2 week and 3 to 4, 5 to 6, and 7 to 8. Remember that you can always do stretching and balance exercises on a daily basis. This is similar. This is the intermediate 8-week schedule for a comprehensive fitness program. And notice that your number of days of resistance training has increased to 3 days a week with a day off in between, so non-consecutive days. And then your endurance training also has increased to 3 days a week. And then with the advanced 8-week schedule for a comprehensive fitness program, you're working out most days of the week. So resistance training is going to stay 3 days a week. Remember, these are non-consecutive days. And then your endurance training is going to be 4 days a week. Remember, you can find this information on the resource page. So just to close, remember that these workouts are provided with your health and safety in mind. However, individuals have their own limitations, so please respect those. It's very crucial that you consult with your physician before beginning any exercise program. These workouts are not a substitute for any professional medical diagnosis, treatment, or advice. By participating in these exercise programs, you do so at your own risk. Make sure you stop if you experience any pain, dizziness, or unmanageable shortness of breath. Enjoy your workout.